The CEO of that company, the nation's third largest U.S. health insurer, joins me now, Ron Williams. Good morning to you, Ron. The headline out of your earnings this morning, it seems to be that you beat, part of that having to do with overestimating how many sick people there would be this flu season.
Yes, I think, well, let me first say good morning. It's a pleasure to be here. We thought we had a very strong second quarter. We have raised our guidance for the year, and we feel very good about the fundamental performance of the company.
Yeah, as Suzanne was just describing, there's so much uncertainty out there. What's happening with your sector and in terms of the employment picture in this country and the ability to purchase health care. Why are costs going up?
Well, I think one of the things you commented on is that we believe that the sector does have an overhang, that we believe companies aren't necessarily trading on their fundamental performance. And until the uncertainty disappears, we believe that that's going to be a fact. I think costs are going up for several reasons in a couple of categories. One is our administrative expense to implement this new important strategic arrangement we've implemented with CVS Caremark, and then also the cost of implementing the new health care regulations. We view a lot of these as one-time costs, and we believe we'll be able to get our SG&A moving back in the right direction soon.
And yet many analysts point to your medical costs actually here, saying that you spent less than expected for long-term disability, for Medicare, and for Medicaid for the poor.
Well, I think in the first part of the year, we did have lower medical costs and a lot of that lower medical costs we viewed as one time. The flu was not as bad. The snow on the eastern seaboard resulted in fewer people utilizing health care services. And so we are forecasting that the medical cost trend will actually be lower for the full year than we had initially given guidance for when we gave our initial guidance. So you have to understand, against our initial guidance, medical cost is down, and we're pricing very consistent with that underlying rate of increase.
Ron, would you give me a sense of how the nature of this recovery is changing your business? I mean, legislation aside, when you look at temporary hiring happening, that kind of hiring often happens without health care benefits. And then you look at perhaps people dropping out of the workforce and simply not having access to health care. Is that going to ultimately push your premiums up?
Well, I think what we're seeing is there is a change in the composition of the workforce as companies are very slow to hire. I think there are two things going on. When I talk to other CEOs, what they're doing is really using overtime to meet their production needs, and really are very slow until there's much more certainty about a lot of the reforms and changes going on in many different sectors. At the same time, consumers were very nervous about job security and were using more services. We think some of that may have been an acceleration of care that would result in lower utilization later.
Acceleration of care. Were people afraid they were losing their health care benefits or seeing the doctor more frequently?
Exactly. For example, you've got a problem with your knee, you know, it irritates you a little bit, you're not quite sure, you've been told maybe you should have something done or not. You're worried about having your job and health insurance, so you immediately go get it done. That's what we believe we saw in the latter part of '08 and in '09. We think some of that settled down, and then we saw less seasonal impact from the flu and the excess snow that we saw in the east.
The weather factor as well. All right, thank you so much, Ron, for joining us today. Ron Williams, the CEO of Aetna.